Good morning, and thank you for joining us here on the Morning Medical Update. I'm Jessica Lovell. It is summer, and just like many of you, we are working hard to bring you some fun and exciting shows come fall. This morning, we are bringing you a rebroadcast of one of our favorite shows. If you have any questions, please leave them below. We will answer them during our live broadcasts on Monday, Wednesdays, and Fridays. So sit back and enjoy this Best of Morning Medical Update. Good morning, everyone. It is Friday, January 28th. Welcome into the Morning Medical Update. Thank you so much for joining us on Facebook and on YouTube today. The number of children hospitalized with COVID remains at higher levels. Supply shortages are also a concern. Dr. Angela Myers joins us with the very latest from Children's Mercy. We're going to talk about childhood vaccinations and when those under 5 may be able to get their shot. Plus, how children are handling anxiety and grief 2 years into this pandemic and how parents and caregivers can help out. Also, Dr. Stites is back. He's here. We're going to talk hospital updates and how to celebrate the Chiefs safely this weekend. And an update in some news that we brought you yesterday. The Park Hill School District is extending its face mask mandate for students and staff. That will be through February 11th. The school board making that decision late last night as classes are canceled once again today as a number of teachers and students continue to battle COVID and other illnesses. So please make sure to get your questions sent into us on YouTube, Facebook, and on the Medical News Network. There are links right there on your screen. But first, let's get to our COVID count this morning with Dr. Hawkinson. Good morning to you.
Hi, how are you?
Hi, how are you?
Good. A little bit, hopefully we are starting to see a trend now. We have only 107 active inpatient infections, 21 in the ICU, 11 on the ventilator. 104 in that recovery period, 211 total. But again, yesterday we had talked about hopefully we can start to see, I would feel a lot better once we get down to that 100 active infections. We are a little bit down there now. Let's hope this trend continues over the weekend. But hopefully this is a sign of some good things to come as far as decreased capacity, decreased hospitalizations for these acute infections.
We like it. We like the number. That's the lowest we've been in a while. And if you look at Kansas, the last couple of days have had some irregularities in some of the reporting days. It's a little hard to know. But I think the trend, I'm hoping it's peaked. I'm hoping Kansas is going to start to see a decrease. We know in the chief medical officer call this week that there was a clear trend downward for most hospitalizations. And so we like that trend. We hope that trend continues. I know there will be probably 78,000 out of the Chiefs game. I hope to be among you. I will be wearing a mask for the entire game except when eating or drinking. I know that I may be in a minority, but that's not unusual for me because I'm kind of goofy. But I think at the end of the day, you just do what you can to keep yourself safe because the virus is still out there. Even though our numbers are down, they're still at an all-time high. And so we have to be a little careful. We think we're down. That means we're golden. We're not golden yet. I'm hoping golden is going to be what we are in March and April. I think that's going to be really a much better time in this crisis. And so I've got a little bit of optimism going this morning, but I think we still have to have some realism. Omicron can spread really rapidly. It can still be dangerous, and you can watch hospitalizations around the country in different states. If you go in the New York Times heat map, you look at state by state by state. The hospitalization curves are pretty different from state to state. It's a little wonky trying to figure out why, and I think people who really study this will probably go for the next 50 years trying to figure all this out. But at the end of the day, what we know is the rules of infection and prevention and control continue to keep you safe. They continue to travel with you wherever you go. Keep yourself safe. Keep the folks who you love and care about safe. Do the right thing.
We have a few reporter questions I want to get to, and then we'll get to any that are on the line. But from the Wichita Eagle this morning, can you explain what you're seeing with children getting sick and dying? Any idea why we are seeing more hospitalizations, deaths, and how does that compare to what is happening across the country?
Well, I think we have the expert here.
Yeah.
Yeah. So we the reason there are more children being hospitalized is because this variant is more contagious and therefore more children are getting sick. So we have a larger number of people who are getting sick from the virus than were previously, and that leads to more people being hospitalized. The majority of deaths have been in children that have underlying health conditions, just like the majority of deaths in adults are as well. Thankfully, death in children is far less common than it is in adults, but But we have seen an uptick in that related to the fact that there's more kids getting infected and then more hospitalizations leading to more serious illness.
But the other thing is we've heard a little bit about Miss C being more of a problem this time around. Can you want to talk about that a little bit? What
Yeah.
it is and what the problem is?
Miss C is a little bit an increase than it has been previously. So it is multi-system inflammatory syndrome of children, and it is really a huge inflammatory response post-COVID-19 infection. And remember that you can have mild or even asymptomatic COVID infection and then still develop Miss C a few weeks later. And it oftentimes affects the heart, so people have decreased heart function. It affects the lungs, the liver, the kidneys. Oftentimes there's a rash, there's high fevers, and there's really high inflammatory markers. Those kids often are hospitalized for several days, some in the ICU, and get very, very sick and need really high doses of steroids and other medications to really decrease that inflammatory response. And although it's not, it's a relatively uncommon complication of having COVID infection. We've seen this uptick this past month due to the Omicron surge, where we really didn't with Delta. So we're now looking at Miss C cases this year in January were around the same numbers last year in January, so we hadn't seen that in an entire year. So it was a little bit of a surprise because we really didn't see that increase in Miss C with the Delta surge over the summer.
Any other reporters on the line? All right, we are going to get to community questions here in just a moment. We just heard from Dr. Angela Myers. She is with Children's Mercy, the Director of Infectious Diseases. We also have Dr. Mitchell Douglas on the line with us. He is the Director of Inpatient Mental Health at our Marillac campus. Good morning to you, Dr. Douglas.
Good morning. Can you hear me?
I sure can. Good to see you. We're going to get back with you here in just a moment. Dr. Myers, I do want to continue on with you. Could you just tell us a little bit about the numbers this morning at Children's?
Yeah, so we have maintained around 30 kids in the hospital since the beginning of January, which comparatively sounds low to the adult hospitals. But what I will tell you is that when you look backward in time, the highest number we had in the hospital previously was during the Delta surge, and we peaked at 22 last summer. So being in the 30s throughout an entire month is significantly higher, and we've had a sustained level of higher throughout this time.
So do we know the impact of the virus on kids under the age of 5, those who are not vaccinated yet?
Yeah, so we're seeing more hospitalizations in younger kids than we did previously. So previously, most of the kids that were hospitalized were teenagers, many of which had a risk factor that was obesity. That was the biggest risk factor that we saw in teenagers. And now we're seeing kids, as infancy, young as 3 months in the hospital with COVID infection. So we're seeing the broader age range expand out and then higher numbers of kids in the hospital.
So one child death we know is too many. There's already been 8 in Kansas. Can you put that into perspective, what that means and how we compare that across the country?
It's been variable in different states across the country. The Northeast has been hit, harder for the most part in child deaths than we have. But, you're right, 1 death is too many, especially when we have vaccine that can prevent infection in kids 5 and above, and hopefully soon for younger children as well.
So on that note, how are we with vaccination numbers of, the different age groups, who's doing well? And how are we getting the word out to get people vaccinated?
Yeah, so we're a little over 50% for those older teenagers, 12 and above. We are, far lower, depending on where you look, around 15 or so % for those kids between 5 and 11. We're not where we should be. We're not where we want to be. We've done a lot of push through social media. We've had mass vaccination clinics. Some schools have held vaccination clinics. Many pediatricians have vaccine available in their office and are really trying to get kids vaccinated. We're also trying to get kids vaccinated before they leave the hospital, as another opportunity. So we've been trying multiple avenues. I do know that there's still some hesitancy out there, and I would just make a plea that you talk to your trusted physician, your pediatrician, your family medicine doctor, and get your questions answered there instead of on the internet.
Yep, good advice. I want to bring in Dr. Douglas. We only have him for a short time. He's got to get out of here early, so I want to bring him in, and I want to set up our conversation a little bit. The pandemic, of course, taking a mental toll on adults and children. But a study out of Canada found that worldwide, the depression and anxiety symptoms have doubled, but that 11% of youth they are seeking help for these symptoms. So the good news, Dr. Douglas, is that people are getting help. We like that. But why the increase? Why are we seeing that right now in the pandemic where we stand?
From having done this now for 2 long years of this pandemic, the thing I'm noticing now more and more, I'm seeing kids who are coming in and dealing directly with a family member who has been seriously ill, hospitalized, or died from COVID. And it's really quite heartbreaking. And so I know obviously Dr. Stykes, Dr. Hawkins on the front lines there, and I'm seeing the downstream. But, oh my goodness, now it's really seeing family systems trying to figure out what to do if a grandparent isn't there, or the grandparent is now in the hospital for a prolonged period of time, or a parent, unfortunately, is there. And there's an article in Journal of Pediatrics in October, 175,000 parents have died. And that's a lot of kids who are running around who don't have parents. I'm starting to see the effect of that just on the family system. If you have a child with baseline depression or anxiety symptoms, and now they're dealing with those significant losses, really direct. We're not talking about anxiety about wearing a mask or whatever, about people not being there in their lives. They're going to do badly. That's just what I'm seeing. I'm not doing a research study. I'm just saying that's what I'm seeing correctly in my hospital. And that'd be a plea to, both for your children to get vaccinated, but for family members to make sure that all the members of the family who are important to the lives of the children are doing everything they can to stay safe and not get COVID.
Well, and like you said, that's just what you're seeing. And I see the same thing. And even if a kid isn't directly impacted by a death in a family, they're seeing it. It's on the news. I mean, I talk about it in my job. My 8-year-old's, I've never had to talk to her more about the idea of death and dying than I have now. I mean, she'll be looking over my shoulder at a story I'm doing and say, did they die? Are they dead? Did they die of COVID? And that conversation has just had to come up more and more. Is it healthy? How do we talk to kids about that? Is it you just face it head on?
You're going to face it. It's going to be an open and honest conversation. It's going to be developmentally appropriate for the age of the child. So the words that you use to talk to an 8-year-old is obviously different than a 15-year-old. But it's going to happen. It's going to be an honest conversation. Also, I really am trying to encourage those slipping in a little bit to what are the action steps that you're doing as the parent to try to make sure that you're trying to keep everyone else safe. So it's not just a description. It's also what can you do? These are the reasons why we're doing these things. These are the reasons why we're getting vaccinated to make sure that we are safe. It's different now than it was 2 years ago. There's really things that we can do to make sure everyone's staying safe, and we're going to encourage everyone to do so.
And put it into context. That sounds like that's really important to do. I want to talk about kids maybe in that older age group, but what's worrying kids right now? I never want to miss an opportunity to hear from you about making sure that kids are getting help and that parents are stepping forward and making sure their kids are getting the resources they need. So talk to us about that.
I always want to encourage people to, if you're seeing your kid and everyone's stressed out now, having that open, honest conversation because like things are horrible. Things are stressful. We got people in the hospital, but we're saying things are fine, but things aren't fine. How are you dealing with this? Giving that open conversation time period where they can talk to you back and be like, I'm doing well, I'm doing not well. And having those real questions about, are you feeling sad? Do you ever feel so sad you feel like falling asleep and not waking up? I can't tell you the number of kids who come to the hospital where the parents really feel like, oh, I thought my kid was doing great. And then the next day, a negative event happens. And then I talk to them, our staff talks to them, really, they've been feeling very bad for quite a while. But they don't want to be able to, they're scared to say how sad they're feeling or how confused they've been feeling. So doing everything you can to have that open conversation. The hope is as parents, we want them to be doing okay. So oftentimes we'll phrase those questions or conversations with kids like around with the assumption things are fine. Jimmy, you're doing okay, aren't you? Juan, everything's going okay. We're okay, right? Right. Okay, we're good. That's not the questions we need to be asking. It needs to be open, it needs to be calm, and they need to be leading the discussion.
And remind parents that it's okay to talk about these things, not to fear that if they bring this up, that it's going to give anybody any ideas. I always want you to remind parents of that.
Of course. I'm sorry, I should have done that before. My apologies. Talking about suicide and the actual word suicide doesn't make people harm themselves or kill themselves or commit suicide. Not talking about suicide means it becomes a secret and you don't know what's going on. You want to ask those direct questions. Have you ever thought about hurting yourself? Have you hurt yourself? There are many kids. We see kids coming all the time. Parents are unaware that in fact their child has tried to hurt themselves in the past. No one told them. They never told anyone. Have you ever hurt yourself? Do you have any thoughts of hurting yourself? Do you ever feel so sad you feel like falling asleep and never waking up? Those are very direct questions you can ask that will give you some information on what to do. And if you find something, you can contact your pediatrician. You can contact your school counselor. If there's imminent risk, you can call 911.
Dr. Hawkinson, did you have something to add?
Yeah, and I'm just wondering too, I think these are all really good points, but I think certainly some kids, and just wondering what your opinion is it more difficult even in phrasing questions or discussing things that way? Is it more difficult for kids to talk to parents rather than another outside source about those types of things as well?
Always great to see the outside source, but I want to encourage people always, because if you can get in to see a therapist, great. If you can get in to see a school counselor, great. I also want to encourage the parents are there, and the parents are there a lot. And so that's your primary contact, because we're all stuck in the house together, to have those conversations. And not rely on an external factor necessarily to be the individual who will find out what's really going on with the child. If you're worried and you can't get the information, get on in, make sure you get the patient to see a therapist. But also make sure you're trying yourself too.
And bringing this all back to getting vaccinated, I mean, we've talked about this, Dr. Douglas, is that you've always said you want people vaccinated because it's crucial that schools stay open and that kids have these outlets and that they have their counselors and their coaches and their teachers and their friends and they have all those touch points. Being isolated at home is not what we want.
Right. We want to give kids normalcy, consistency, back to the rhythm of life. I mean, how sad is it when young kids are talking about things are a little better now, but they lost, depending on the school district or the area, 12 months, 18 months of their normal school experience. And even now we're seeing with the recent outbreak, everyone wants to get the kids in school, but some school districts you don't have teachers. And so you can't have a kid in school. And so we're now right back re-traumatizing the kid with experience of what happened 18 months prior. No school, remote, back to that situation.
All right, thank you for that. We're going to get to some community questions here in just a moment. So let's just jump right in if you guys don't mind.
And just one thing, while you're looking at it, then we asked Dr. Myers a question. So I'm going to guess that children, you guys are also seeing a large influx of mental health concerns for kids.
We really are. We, through our emergency room and then also in the inpatient units, we have a huge number of kids with mental health problems and mental health diagnoses. And, it's hard to get, sometimes it's hard to get kids the help they need. A lot of the mental health facilities have obviously COVID precautions as well. And there's a larger number of kids, so there's not as many beds available. And some of these kids end up being in the hospital when they really need to be at a mental health facility, but there's just not room. They're not beds for them. So, we're doing all the things we can at Children's Mercy to care for those kids in the best way possible. And I know that our mental health facilities are doing all they can too for all the kids they are seeing. This is really hard, and I want to echo, what was said earlier about the need for kids to be in school. They have got to be in school all day, every day. This idea of opening and shutting is not good for kids, and we've seen this throughout the pandemic. So it is vaccination and everybody who can get it, and it's also continuing to mask. And I really appreciate, the discussion earlier about some schools have been continuing to prolong their mask mandate while the Omicron variant is still so high in the community.
And I think the key to this is, we all, I think we're so tired of it that we're starting to fight with each other. So imagine if the Chiefs play Sunday and Kelsey and Mahomes are mad at each other and they're not talking and they're not playing right together, right? How are we going to do? How's that game going to go if that happens? But when you play as a team, then things work. I think the key is we all want these kids to stay in school. And the only way to do that is to follow the rules of infection prevention and control, because they still apply, right? You put a bunch of people together in a small area, and all of a sudden you're going to shed the virus. I mean, it shouldn't be a surprise to anybody. It's been going on for actually been going on for a lot longer than that. It happens with influenza, it happens with RSV, it happens with all sorts of stuff. It's not new. What's new is this virus has been so present with us, it just feels like it's going to be forever. But I think if you could just, okay, I'm going to speculate, and Hawkeye hates when I do this, but if you could just look beyond the river bend, I love going floating. If you just look down beyond the river bend, what's around the river bend? And I think what you can say is, look, the numbers across the country in many states for Omicron infections are down by 75%. Up in New York, look at their curves. They have plummeted. We are on the precipice of the plummet, which is really the side you want to be on, right? You want to be on the other side of that. We're going to be on the other side of the plummet. When that happens, you look worldwide, there's not another variant out there right now. Cross your fingers that we keep it that way. And if we can just get past this, we could have some pretty darn good days come March and April. And then when people say, let's take our masks off and go to a restaurant, we're going to say, yeah, order me up. But instead, what we're saying right now is, just be cautious, but you're on the precipice of something good. So don't blow your chance. And worse yet, don't hurt your kids by forcing them to blow the chance. Remember, we're on the same team. The way to win the game is to follow the rules and play your best. That's how we're going to beat the Bengals, by the way, which we're going to do on Sunday.
Thank you for that confidence. But back to schools, I think what's hard about it is this time last year, schools were doing it so well. And so now we're having this problem. And I know Dr. Myers, I mean, you've got kids in school, Dr. Hawkinson does. I have kids in elementary school. And that was the one place that I thought was doing it really, really well. Everybody following the rules, wearing the mask.
Right.
Yeah.
I think you can just say, guys, they took their masks off.
Yes.
That's exactly what happened.
Yeah.
Simple.
So when we see the mandates, just like Park Hill continuing on, we like that. Please follow
Yeah, 3
suit.
cheers, Park Hill. Well done.
Love it. Okay, Bev wants to know, as do many other people, Dr. Byers, wondering how long before under 5-year-olds will be able to get their vaccine. The crystal ball moment. Here we go.
I know, this is a really great question. I have read some things in the news that the FDA might be meeting earlier than expected to make a decision about authorizing the vaccine for kids under 5. And then, of course, the ACIP, which is a group from the CDC, has to make those recommendations. You know, I don't know when that will be. Our hope is that if we look around the bend, I will use Dr. Stites'
Awesome.
phrase, looking around the river bend, that we will be there, you know, soon, March, April, like come spring. I think spring is going to be amazing, and I can't wait for it.
I think it's going to be amazing. Hawkeyes are going to be amazing.
I
See,
think it
I knew
will
he was
be.
going to do that. I knew he was going to do that.
I do. I think it will be. I think people are looking for a single, simple answer, and it's not a single, simple answer. There are confounding factors here. What is going to make it better? I think we are going to continue to have this virus circulate. But, can we cut down on the hospitalizations and deaths? That's extremely important. We know that other variants are going to arise, but how well are we going to be able to be protected to help keep hospitals from filling up due to this, to help keep other essential businesses, and there are many. The people that we see every day to buy our food from, to deliver our food, all of those types of businesses. If we can keep those people healthy, everybody healthy, working, I think we are. But it's going to take a little bit of time. But yeah, absolutely, it will be a lot better moving forward.
I think it's, and just remember last March we got down to 3, 4, or 5 patients that are inpatient census, which was awesome. We want those days to come back.
Hey, Dr. Douglas, Joellen wants to know, what do you think of the role of telehealth in making sure that people are getting the mental health issues that they need cared for? Are you learning to adapt to telehealth? Are you back to in-person? Tell us a little bit about that and how effective it is.
Sure. And telehealth is a great resource if you can't get in to see a person to see a provider in person. KU's definitely been expanding their child psychiatry outpatient telehealth services. I think the standard where there is some type of inpatient in-person encounter with a child to do the physical exam, to check some vitals, to really see the kid, face to face, and then have subsequent follow-up outpatient via tele is a really great model as well. And so I like that model where you're seeing the kid in person, telehealth follow-up, checking in person as well. There are some things we need to do as physicians physically with the child to make sure that things are okay. certain medications can have side effects, which can be need to see the patient in person, which are harder to do via the telehealth model. But that said, if you can be as if you're seeing a therapist, telehealth, that sounds fantastic. I have heard, and I do an afternoon week of telehealth. After a while, we're really hearing more and more input that families want to be seen in person. And so that's kind of an interesting thing that we've discovered. So I think the best solution is going to be a combination. We're going to have more options available, things we can do to provide help to kids, and that's going to be telehealth. That's going to be in person. We want to have IOP, intensive outpatient programs. If a kid needs to be inpatient, we want to have a full armamentarium of ways we can try to help kids so they can be seen in the right environment for what their needs are.
Dr. Douglas, Melissa has a question, and we know that we've had trouble getting the age group, 12 to 18, vaccinated. How are you handling that in an inpatient setting? What are you seeing, and are you able to have face-to-face with parents and kids about encouraging them to get vaccinated?
We are very excited that we are a child psych hospital that is doing vaccinations in our facility with consent and ASENT from patients and parents. With that happening with some, not all patients, but we love having a discussion and encourage them. And sometimes, with vaccination hesitancy, it can take two steps. It can be, in one setting, having a physician encourage vaccination, and then maybe they hear it again, and the second time or third time, they'll be willing to go ahead and get vaccination. We've had to really change our whole model of care with COVID. So we've gone from an 84-bed hospital to a 42-bed hospital, to go from 2 patients per room to single room occupancy. We've had to change the way we do our groups. We've had to change doing a lot more of our family sessions over the phone as opposed to in person. So we've had to really remodel how we've done inpatient psychiatry with COVID. It's been a challenge. And that leads to the problems that Dr. Myers is addressing, where how many kids are at Children's Mercy right now waiting for an inpatient psych bed? 15, 20? I mean, probably as many as have COVID, possibly. And unfortunately, with COVID, we've just had such a decrease in our capacity that we're always running close to full.
Dr. Douglas, I know you have to get going. We really appreciate you being with us today. It's always such an important conversation and a great reminder. So thank you. I'd love to hear your final thoughts, though, before we head out.
Take care of your kids. Tell them that you love them. Give them as much normalcy as you can give them. Get them to school every day. Pack the lunch. Grab dinner together. And have some conversations, but really open conversations how they're doing. And if they need help, get some help. And I want to thank Dr. Myers and Dr. Stike. Thank you all for your leadership.
Thank you so much. Thank you so
you.
much. Great advice, and I think we can do that. Dr. Douglas, have a great weekend. Okay, so a couple other questions. Michelle wants to know, when will boosters, and are boosters going to be available for those over 5?
Yeah, that's a great question. I don't know when that decision will be made. Keep in mind that kids 5 through 11 just got authorization for vaccination in November, so they're not anywhere near ready for boosters at this point. I'm sure that by the time we need to be concerned about that, the ACIP will have met and made a decision on that.
Okay, Candy wants to know, what is the time frame after kids get COVID that they could see complications of MIS-C?
Yeah, that's a great question. The typical time frame is 4 to 6 weeks. It can be as early as a couple weeks, but typically it's more around a month after the COVID infection. And remember that the kid's COVID infection may not have been significant. So they may have had a parent that was infected and the child tested positive because they got tested, and they may have only had a sniffle, or they may have been asymptomatic entirely and then developed this multi-organ systemic inflammation.
Curtis has a question. Overall, are cases getting better?
Better in terms of numbers, or better in terms of how they're doing?
I think he
clinically?
means how they're doing.
Yeah, so, here's what we know. Omicron has resulted in a lower rate of hospitalization per infection. The problem is there are so many infections all at once. We have the highest number of hospitalizations we've ever had in the United States, by far. And in Kansas and at KU, by far. But it's because so many people are infected all at once. It used to be the peak per capita in the United States was about 200,000 new positive tests a day. Now we push 800,000. And that's just the tests we do. That doesn't count all the home tests, the people who aren't being tested. So most people would say we probably are getting 4, 5, 6 times the number of new infections are happening this time. So that's why you have so many more hospitalizations. if you are hospitalized, the rate of ICU being put into the intensive care unit has dropped by about 40 or 50%. So you have a lower chance of being in the ICU once you get hospitalized. The problem is, once again, because you get so many people hospitalized, there can still be a lot of folks in the ICU. And then if you peel back our ICU numbers and you say, well, was the vaccination still helping? Here's what we know. Of our 22 or so, 25, whatever the number was today, patients in the ICU, only 2 of those patients are fully vaccinated and boosted. It's because now we have to talk about and boosted, because so many folks now are a year out of their original vaccination series. And so the further we go, if you haven't been boosted, the longer the time it has been since you've been at your primary vaccination series, then your effectiveness is beginning to really drop. So again, the keys to this crisis are simple. They're the same ones they have been the whole time. Get your vaccine, right? Wear a mask, and avoid crowded indoor places without a mask. If you do those 3 things, you really can stay very safe, Hawk.
Yeah, absolutely. I think we continue to have to talk about confounding factors, and I think really the major confounding factors here are that, and especially even in South Africa where that early data came from, a lot of those patients were infected previously. There was an increasing vaccination rate. I think that's what we're seeing. We are starting to evolve really as humans, as now that we've had exposure to this virus. That notion of the virus becomes less virulent, that was put forth by somebody. We know that truly it has only happened that we have seen in the history that we know of is with a rabbit virus, and I think it was rabbits in Australia that they had tried to infect and get rid of that wild rabbit population. But if you remember, smallpox hung around a long time, continued to be very deadly. We know chickenpox really hasn't changed since it first came out. Herpes viruses, those things have not changed. Now, maybe when they first jumped into the human population, yeah, but we weren't really aware of that. But I think really the best example is smallpox, and we know how dangerous and deadly that was until we were able to eradicate it from the planet. So I think that's an important thing to remember.
And how did we eradicate it?
What's that?
How did we eradicate it?
Vaccination.
Vaccination.
Absolutely.
Yeah, there you go.
Polio is still around. That really didn't change either. So I think those things are important to remember. But what is important is how our body individually, and then of course as a population through vaccination, how our body individually can react to that virus, either after vaccination, which is always going to be much safer, or after repeated infections, which again, anytime you get infected, you do roll the dice with the complications of the virus and the infection itself. So I think there are good things to come, but we will just continue to wait and hopefully keep everybody protected and keep these cases coming down, just as Dr. Stites talked about.
I believe the Kansas City Star is on the line and has a question. Go ahead with your question.
Hello. I was wondering, what advice do you have for people who might be going to watch parties, bars, places like that this weekend? What do you want to say to those folks, and do you have any tips or advice ahead of time?
Yeah, you bet. My first advice is to wear red. And my second advice is, the more serious one obviously, is you just have to assess your personal risk, right? It comes down to what are your personal risks. If you're fully vaccinated or you've recently had COVID, and if you've had COVID plus a vaccination, your risks will be a little less. But the simple reality is when you put people into a crowd and you bring them together, if you're unmasked, the likelihood of getting the virus, and even if you've been vaccinated, even if you've had it, and then you can take it home and you can share it to whoever your family members are, is not going to be insignificant this weekend. Even though the new numbers appear to be turning downward, they actually have turned downward in Kansas City. The thing we have to remember is that it's still out there. There's still a high degree of prevalence. You can still shed it and spread it, and that's the struggle. So my advice is, man, take stock of your situation. You're always better outside than inside. If you're going to be inside and you're not actively eating or drinking, put a mask on. And the better quality mask you are, you can. I'm going to go to the football game. I'm going to be in red. I'm going to have a red mask on, and it's going to be a really good mask. And I know that those things will help keep it safe. And to me, and here's just a personal moment, right? Should I really go to a crowd of 78,000 even with a mask on? It's a little hard. But it's a personal risk. And I'm like, okay, I still want to go, but I'm going to do my best to protect myself by wearing a mask. And I think masking makes such a difference. I think, Dr. Myers, for kids, masking makes such a difference because we saw even in schools, masking kept schools open, unmasking doesn't.
100% masking does make a difference. And I echo your sentiment about being outside when you can. It's actually going to be a little bit warmer this weekend, and the game is early. So it'll still be sunny out. It'll still be nice. So spend, the first half of that game outside. And again, decreasing your risk by spreading out, staying outside, then wearing your mask inside.
Dr. Hawkinson,
I would just say I echo Dr. Steitz's thoughts. For those of us that are vaccinated and up to date with that booster, we should be now allowed to be able to take those risks because we know we are protected from the most severe cases and the ability having to go to the hospital. But I think you have to take other things into account too. What is the overall community spread? It is still fairly high, but taking those own risks and benefits into your mind when you are making those calls. Certainly, we know it is fun to go to those things and be with friends and even other people. If you're going just to a bar or something like that, but just do it in a thoughtful manner and take into account. What is your immune status? What is your vaccination status? Are you up to date and boosted? What is the overall prevalence? It still remains pretty high, but you just have to think about all of those things when you do that.
Last question is from Teddy and Nancy. How soon can my 5 to 11-year-old get vaccinated after they've had COVID?
Great question. So, what we've said from the very beginning is 10 days from that diagnosis. Just because we don't want you to be contagious when you come to get your vaccine, not because there's any other reason you need to wait. Really, when you're feeling good, you can get the vaccine. So remember that the CDC recently changed the isolation guidelines to 5 days isolation, and then you can leave and wear your mask and all of that. But we're typically telling people still 10 days from the diagnosis before you get your vaccine.
All right, great questions today. Did you have
I would just like to say, Dr. Steitz and I have been discussing this as well because we get this question now, especially with Omicron. When should I get the booster now because I was just infected? And, certainly this week I kind of changed the thinking a little bit. We know the recommendation is exactly what Dr. Meyer said, and we've said that as well. They said there was no minimum time between infection and vaccination. But we also know now that the CDC does continue to say that you are considered immune for 90 days after that infection. And so I think the important thing, and this goes back also to that first question about the booster after that second dose. And really what's important here is that time frame from that second dose to that third dose, because it's within that time frame that your body is evolving. Those B cell and T cell responses are evolving. So when you get that third dose, you are now boosting that full immune response that has been evolving for 6 months. So I think based on that, really, the guidance, number one, you are considered immune for 90 days if you've been infected. Number two, although there is no minimum time between infection and vaccination, if you've already had one dose of that vaccine, getting that booster, I think 60 to 90 days later is certainly reasonable. And at that point, you are also going to be boosting that that infection immune response that you've had as well. So, but no specific guidance from the CDC. But when you take those things into account, I think it's pretty safe to do it. Any time after the infection. But if you needed to wait 60 or 90 days, that is probably reasonable as well.
Dr. Angela Myers, thanks so much for being with us today. Final thoughts?
Sure. I think that everything that was said today is correct. I think we're on the edge of the downhill slope for this, and I want people to just hold on a little bit longer and continue to do your good infection control practices. Continue to get your questions answered. If you're not yet vaccinated or you have a child that's not yet vaccinated but is eligible, please seek out your doctor's advice. We are here to help you. We are here to answer those questions. We're here to help you through that decision making.
Dr. Hawkinson.
I think I just echo Dr. Steitz's, Dr. Myers' points. It's going to be a fun weekend. Chiefs are going to win. If you're going out, think about those things that we've talked about. Be thoughtful in your decisions, but otherwise have a good time. If you haven't been vaccinated yet, please go get vaccinated. If you are due for your booster, please go get that booster.
Dr. Seitz, do you mind? I'm going to tee up your final thoughts with a little love that's being sent out from the Chiefs fans.
Okay, let's do it.
So I want to pull up the picture right there. We saw this going around on social media, the challenge that went out urging Chiefs fans to donate $13 to the Buffalo's Children's Hospital, that charity supported by the Bills quarterback Josh Allen. Donations have already reached about $300,000. $13 for those 13 seconds that Patrick Mahomes and crew used to tie up the game last week, ultimately winning and sending us into this weekend's AFC Championship. So the hospital is going to use that money to help care for kids, new equipment, training. So again, a lot of love from those Chiefs fans. So good
You know
stuff.
what that is? That is known as being on the same team. And I used to live in upstate New York, and my second favorite team in the National Football League happens to be the Buffalo Bills. I'm still glad we won. But at the end of the day, it's a good message, right? We really are all on the same team. And if we play like a team, we can win as a team, and we're going to see what's around that river bend, because what's around the river bend is going to look really good. So let's get there together.
All right, let's do it. Go Chiefs.
Go Chiefs.
Chiefs.
All right.
Let's do it. All right, everyone. Thank you so much for being with us today. Don't forget you can catch our show anytime by logging on to our Facebook page and also our YouTube channel. So everyone, please have a great, safe weekend, and we'll see you back here Monday at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.
Thank you so much for joining us this morning for this Best of Morning Medical Update. You can catch our live broadcasts every Monday, Wednesday, and Friday. And don't forget, you can always email us at medicalnewsnetwork@kumc.edu or reach out to us on Facebook, Twitter, and YouTube. We will be back to our live shows 5 days a week starting September 6th. So please go out, make it a great day.